Hey guys, welcome back to the podcast. I'm Amanda.
I'm Laura.
And I'm Kendra.
And today on Drive Time Debrief, we have a very special guest. You probably know her best online as Paging Dr. Fran. Dr. Fran is a board-certified OBGYN, residency faculty member, hospital medical director, and one of the most recognizable physician educators on social media. Through platforms like Instagram and TikTok, she reaches over 1 million followers, translating complex medical topics into clear evidence-based information and tackling a huge wave of misinformation circulating online. You must be exhausted because there's a lot of it.
Thank you so much for having me.
Yeah. So she originally started posting in 2021 after noticing how much inaccurate information about pregnancy, contraception, and women's health was spreading online, and realizing physicians couldn't afford to stay silent anymore in those spaces. And since then, her work has expanded beyond education into advocacy and physician representation online, helping amplify credible medical voices in an era where algorithms often reward the loudest voice rather than the most accurate one. So today we're going to talk about practicing medicine in the algorithm era and how misinformation affects physician-patient relationships and what that means for physician wellness when your clinical expertise is constantly being challenged by TikTok. Dr. Fran, welcome to Drive Time Debrief.
Thank you for having me. This is wonderful.
I am extremely excited. I've been following you. I'm excited because your dad's an ER doc, so that's exciting.
Yes, he is.
So welcome to the neighborhood of the burnt out EM docs with sarcasm and dark humor.
I've known that my whole life, okay?
So this is family. This is just family. Well, we'll start with talking about your origin story. You said you started posting because you were seeing so much misinformation online. And for the physicians listening, I know that a lot of us feel so frustrated. Especially, this is my pain point. It's coming out in my testimony right now that the patient comes in and they're really convinced that what they heard on TikTok or Insta or something like that is the diehard truth, and they're willing to go to blows for it. I'm not sure who's convincing who at some point, but what was the moment when you realized physicians actually need to be present in these online spaces instead of just being annoyed by them?
So in 2021, I had just graduated from residency and I took 6 months off to be home with my children. And 2021, still like COVID times, I was spending a lot of time on my phone scrolling on TikTok, and I was at home with my small children and I was breastfeeding one day, and I came across this video of this other woman who was a pumping mom, and she was on a bachelorette party and she was filming herself pumping and dumping her milk. And I, as a breastfeeding mom who also had a lot of interest in like lactation medicine, I was like, oh my God, you don't have to like pump and dump after having like a drink. Like you should go to the clubs with your girlfriends. And I was like, well, I'm finally at a place where I feel like I can talk about these things online. I had been a blogger for like my medical school years, but it was always like about myself. It was never about medicine. And so now I was in a place where I had finished my residency and I had a lot, obviously the knowledge to talk about it as well as the history of making content. So I was like, oh, I'm just going to like make a video about this because like I want this poor woman to know that she doesn't have to pump and dump. And then I just enjoyed the process of like making videos and talking about medicine and being a mom of young children and those things. And the more time I spent on my phone watching videos and making videos, the more the algorithm would show me these incorrect videos. And so I just really continued to do that and really started to see how important it was to have like a credible voice, to have someone say like, I am a board certified OBGYN. I'm giving you the data. I'm showing you the studies and making it easy to digest for you as like the lay public. And that's really kind of like how I started. And not much has changed in those years. You know, I continue to do the same thing. I keep seeing videos that just come across my FYP and I'm like, I have to address this. And sometimes it's disinformation, right? Sometimes it's people purposely putting out misinformation. And I think they're very good at creating that type of content. And a lot of it is just misinformation, people misunderstanding things or not really understanding all of it, or they've heard one thing and now they're continuing to talk about it as if that's the truth. And so it's kind of a combination of like helping people who are just talking about their health things or asking for questions online, and then also addressing the people who are very purposely, in a way, poisoning the minds of our patients with disinformation.
Yeah, I love that because it is exactly that. You do have great content out there. There are some honest voices out there that have data and intellect behind them. But then you have those malignant people and the ones that do create a lot of confusion. And so I think one of the things that I have learned is just showing up, accepting that those people are just looking for information. And unfortunately, these days, we have it in our hand 24/7. We can click on anything and get any information. And so realizing that and how easy and accessible it is to get any information is really important.
Yeah, I mean, I think what I've really thought about over these years is like, how did we get to this point with patients? And I think a lot of it stems from COVID in a way, right? People kind of realize that medicine is not this like perfect science, that it is like the art of medicine. We're always figuring out new things. But at the same time, like the systems that we work in have really put a divide between us and our patients. We don't have nearly as much time with our own patients as we'd like, especially for those of us who work like in offices, right? Where we have like very scheduled, like I have 10 minutes with you and that's all I get. And so because our patients really are desperate for more time and like education that we don't have to give them, they go online to the people who are willing to give it to them for like good or for bad.
Yeah. And on that point, patients are learning more about health and health topics and medicine and disease states from social media. And usually they'll Google their symptoms, right? So then that takes them down the next rabbit hole. So even before they show up at your office or in the ER, they are researching things, they're looking up things, they hear something. And so, how can doctors really show up and rebuild that trust in the exam room with only 10 minutes to do it?
I mean, I think the first thing you do is just acknowledge them and just be like, I hear you. I'm so glad that you are interested and want to learn more about your condition, right? You really want to show that you guys are on the same team. You're not there to fight them on that, but you may be there to point out why what they saw doesn't actually apply to them. So like for me, I see this a lot in obstetrics where patients see a lot about like low risk births and like low intervention pregnancies and those kind of things. But then I have to take that to my patients and be like, I understand you saw these things for low risk pregnancies, but you yourself are not a low risk pregnancy. And so let's talk about what you liked about that and how we can apply some of the same principles or get parts of that out and make it applicable to you. So I think the most important thing that any clinician listening can do is just not immediately dismiss them, because your patient is interested in their health, right? Like we should be commanding them for trying to educate themselves as well as they can. If you immediately dismiss them, like that's the end of that relationship, right? So hear what they have to say and then see how you can apply what they learned to their specific situation. And sometimes you have to say like, that doesn't apply to you, and here is why. And that's where it's 30 seconds. It's 30 seconds to say, this doesn't apply to you because you don't have this condition, or you're on these medications, or we did this testing and you don't actually have this, and here's why. And then your patients feel heard and they feel they understand their condition better.
That's a big point there, is just them leaving feeling heard. And that could be just reflecting back what you just said.
Yeah.
I know you saw this or heard this, so I hear you, meeting them where they're at and then saying, but in your case, and I think that also not only builds trust, but it also lets them leave saying, oh, okay, so now I have an understanding. Like, even though this looked attractive or this seemed like it might work, okay, maybe, I'll have to make an alternative birth plan or whatever in your case. And I also think that it will allow them to be more compliant. They'll come back the next time and be like, okay, now that I know this, and they'll feel like they had a hand in making the plan or deciding. And I think that also breeds that, collab spirit that I think just, again, will deepen that trust in that relationship.
Yeah, I mean, really, our patients just want to be heard and they want to understand what's going on. And so it's a little bit on us to like keep that relationship open, even though we want to like pull back, right? We want to be like, that is the most crazy thing I've ever heard. Absolutely not. But that is not going to help the patient, physician relationship. And so keeping it open, especially in the beginning, so that you have the room to get into why that doesn't apply to them, and just having those 10 extra seconds to say, I hear that you are interested in this. This doesn't apply to you for this reason. Or I hear you think you might have this. The testing we did shows that you do not, right? But I want to continue to work with you, or let's find a different thing, or let's like pivot a little bit to make it all work. So just staying open to them is going to, in the long run, benefit you more than immediately being like, nah, that's crazy, and the internet tells you the dumbest things, right? That's not going to make someone want to like talk to you more.
Yeah, exactly. So when do you think the emotional toll of misinformation, or constantly, having these conversations and battling the things that patients come in with, I say battle loosely, but it is a constant conversation. When do you think it becomes a physician wellness issue and really contributes to some of our moral injury and burnout?
Oh my God, all the time, like from day one, right? Like you can have those patients in your office back to back to back. You know, my husband's a family med doc and he doesn't spend any time on social media. He doesn't even have a Facebook, like nothing, right? But he's like, so is ADHD trending on TikTok right now? Because I've had to discuss it 14 times today, you know, those kind of things. And so like, I think for everyone, like early on, right? Because it's hard to remain like empathetic and to be like patient and all those things. So like, you know, for all of us, and especially currently in the current like political climate, and that trickles all the way to the internet and that trickles into our exam room. So I'm sure everyone feels a little bit like tired, understandably so.
Yeah. I really appreciate that you're highlighting the need to not dismiss their concerns whole cloth, because the reality is, and you trained after we did, I hope things were better for you. However, definitely being dismissed was something that we swam in constantly. And to have to shift ourselves from being like, no, that's ridiculous. It requires a real intention, because that's not how we were trained. We were told stuff was ridiculous, right?
Yeah. I mean, it's hard. You go through a lot of training to become a physician. And it's like, if you haven't gone through it, you have no idea how hard this whole process is, right? And that hardens you a lot. Like, it takes a lot to have to work 24, 36-hour shifts, even as, you know, attendings now. Like, that life hardens you. And so when people come in with something that you feel is not as hard as like the things that you've gone through, it's hard. Like, I remember when I had 2 of my pregnancies during residency, right? So there I am, 38 weeks, hour 23 of my 24-hour shift. I am like miserable. I was puking every day. I'm a resident. I'm a second-year resident. People would come into triage and they'd be like 20 weeks and like, yeah, I'm just really tired. And I think I want to be out of work for the rest of my pregnancy. And I was like, are you kidding? Like, are you kidding? You know? So like, it hardens you because we've all had to do really hard things. But we chose to do this. And we chose to like not put what we have had to go through on our patients, and our patients are there for our help. And like, you have to continue to remind yourself of that, despite how hard you worked and how hard your life in some ways was. That doesn't count when the patient's there to seek your medical advice.
Yeah. I think you gave some examples of some good phrases to use when someone comes in with, well, I saw online that. Do you have any other ways that would be productive ways to respond in that moment without damaging the relationship or dismissing them?
I mean, you can just ask them if you can watch it together, right? If someone's like, I saw this video and I think I might have that, you'd be like, well, let's see, like, watch it together quick and see like how they present and if that like applies to you and what they recommend, right? Like, sometimes they have it pulled up because they want you to hear it. And so I think, again, it's a way to show that you're open, and especially if it's like something new, right? Because a lot studies come out all the time and people will make videos of it. So for example, I make videos about new studies that have come out. And so I can imagine that one of your patients saw that Dr. Fran made a video that if you have recurrent BV, you should get your male partner treated. This might be news to some of you, right? Because like, it is new and you may not work in the field that I do, but you work in the urgent care, and they show up and they're like, well, I saw online that you can treat the male partner. And that might sound crazy to you until they show you the video of Dr. Fran, the board certified OBGYN, showing you the New England Journal of Medicine article showing how helpful it was. So sometimes, especially if they say like, oh, I saw this study or a doctor was talking about this, like, you can just ask them, like, let's look at it together, because it might be real, right? It might not just be like a chiropractor making something up. So I think even just asking them to see it might be like helpful.
Oh yeah. I love that. I love that because I learn stuff from my patients all the time.
Yeah.
So I love that. Women's health in particular seems like a hotspot for viral misinformation, unless I'm wrong, but I think
no, you're
that's
right.
true.
You're right.
Like birth control hormones, fertility, pregnancy. Why do you think that is?
Oh my gosh, this is so multifactorial. First of all, our field is heavily politicized, right? So politics probably gets more involved with our health, the medicine that we practice, more than anyone else. And so it comes from the top down. We have whole laws that change, all those things, right, that trickle down. The field of especially like pregnancy and preventing pregnancy or not being pregnant has a lot of religious undertones associated with it. So there's a lot of people who have opinions of like, you shouldn't prevent pregnancy. If you have a pregnancy, you shouldn't ever get rid of it, right? So there's that aspect. Obstetrics pediatrics and the women's health as a whole has been very, very, very underfunded. That is not just my opinion. That is like a fact. And so we just don't have the studies. We don't have the medications. We don't have the surgeries. We don't have the prevention tools that many other fields of medicine have. You know, my strongest example I always use is that PCOS affects 20% of women, and we don't have a single medication that was made for PCOS. Can you think of any other diagnosis that 20% of the population has, and you don't have a single thing just for that? We have to use every other medication to try to like piece together like any sort of quality care. So now think there's 20% of women who have this condition who their doctors say, I really don't have anything to do for you, right? Luckily now we have like GLP-1s and that can help with some things, but still not just for PCOS. And you can apply that to every other medical condition that affects gynecology. And then on top of that, I feel it when you think about like physicians and the work of especially more historically OBGYNs, these doctors and like many who are probably listening if they're OBGYNs practice 24 hours a day, 7 days a week. How tired can you be? And one, how tired can you be? And two, we're expected to do so much and be so great at everything. You have to be the best endometriosis surgeon. You have to be the best high-risk obstetrician. You have to be a menopause expert. You have to be able to do all your pap smears and all of the surgeries. And it goes on and on and on. And that's like a lot of things to be the most expert in for everything. And so no one's that great because you can't be the best at every single thing, but historically we were expected to. And so it's all these things that make tired doctors who don't have enough information, who don't have ways to help people. And the field that we work in is very vulnerable, right? Like vulvas and vaginas, like that is a very like private space for them. And so any sort of work that has to be done there, especially if it's painful, if it's related to your own history of assault or whatever, that is more traumatic. So it's just, there are so many reasons that like that is our fault and that is not our fault about why things online get to be where they are. Patients feel dismissed and then they are upset or something hurt and we didn't do a good job preventing that hurt or taking them seriously when they said that it hurt. And those are the videos that go, you know, viral. And I mean, obviously I've thought a lot about this, but there are some reasons that women's health online becomes such a hot topic button and why the videos go so viral. And it's always the same videos, right? Like it's the videos who are making up what sounds like or could be like, which sounds good, right? There was one recently that went like very viral that a bunch of people recreated, like, isn't it a coincidence that we were all put on birth control in our teens and now everyone has to go through IVF? It's like, yeah, that is a coincidence. The only reason that's happening is because you were put on birth control and you got to delay your fertility until you were ready to have a baby at 35. And now turns out it's harder to have a baby at 35 than it was at 17, right? It's not because of the birth control itself. It's because of the choice that you made to delay your fertility, which like me too. But those videos go viral because they make people be like, oh yeah, this conspiracy I've always thought was true is so true. And like everyone, you know, it just is a continuation of that.
Yeah. Wow. That's wow.
It's a lot.
Preach it. Preach it. So tell us also though about, you've got resources to combat this kind of misinformation on your website, pagingdrfran.com. Should more doctors consider making resources like that?
Oh my gosh, yes. I mean, for like people who ever consider content creation, creating some sort of resource for patients is the reason I gained a lot of my following. You know, my TikTok Tubal list that I created back in 2022 is the reason I went from like 7,000 followers to 100,000 followers in a month, right? Like I created something that patients were looking for. Patients were looking for doctors who would sterilize them no matter how old they were, if they had children or if they were married. And, you know, that grew very quickly because there was such a need for it. And so, you know, and all of that came out like organically. I also have like an elective induction fact sheet because I was sharing that I was choosing to be electively induced and so many people had questions about it. And so I wanted to create something that like highlights the data, like what studies are out there on elective inductions. What should you ask your doctor before you choose to be electively induced, right? Because patients were asking me like, I don't even know if I should do this. I'm like, here's a list of questions you should ask your doctor and see if you're making a truly informed choice. Because again, we only have 10 minutes in the office. I can't spend all this time with you talking about elective inductions other than giving you the quick highlights because I have 14 more patients to go, right? That's not fair to the patient. They wanted information. And so I wanted to create something that was evidence-based. Here are the studies. Here's the synopsis of the studies. Here's the link to the studies so you can read it yourself. And then here's something that you can take to your own doctor and talk to them and see how it applies to you. And so, yeah, I mean, you know, I'm sure many people listening have dot phrases that they put in their after visit summaries. This is really no different. This is just making it more accessible to other people and not just your patient in front of you.
That's so brilliant. So one more question here. Historically, medicine has not always been super supportive of physicians building these public platforms. Do you
Yeah.
think medicine is evolving in how it views physicians who are educators or creators outside the hospital?
I mean, I think so. I think there's been such an explosion, and maybe this is just my like For You page showing me what I've already seen, but I see so many new physicians popping up and making content, and I'm just constantly trying to like reshare their stuff because I want more people to do it, because I think really people do understand how important it is to have credible voices online, because we all see the misinformation in our clinical work, right? And so for someone to want to put themselves out there and really tackle that, I think anyone who's in a leadership position, I hope you really support your physicians doing this. I am so thankful that my own, chair supported me so much. And, when you get to a certain number, and even maybe just with 100 followers, someone could take offense to it and try to get you in trouble. And the reality is that has happened to me. I am just so thankful that my boss has always been very supportive of me. My hospital system has been very supportive of me. And they've received a lot of new patients in their hospital system because of me. And so that's the other thing to recognize, right? Is that a lot of patients want to know their doctor. They want to have that kind of like familiarity with their physicians, or patients know what they're getting with me. They know who I am because they've seen my videos and they know what I stand for. And so, if nothing else, on a business sense, it's smart, but on like an education sense and making our patients like trust us more, like we need more doctors of any type of specialty talking about the medicine that they practice and the work that they do and addressing the misinformation when possible, because our patients are seeking it out and we really need to be like filling those holes rather than letting naturopaths just say whatever they want.
Amen.
Yeah, for sure. And before, you have encouraged physicians to be more active online in order to combat that misinformation. But I'm already imagining some physicians, I can't do one more thing.
Yeah.
Do you think participating online is becoming part of the job responsibility for physicians, or is that asking too much for a profession that's already burned out?
Yeah, I mean, definitely, I would never recommend say like every single one of you has to like be on TikTok, right? I think one, there's ways that you can educate still that isn't in video form. You don't always have to make TikToks. You can go on Instagram and just make like carousels of pictures. You can write a blog. You can write a Substack. You can just tweet things. But I also don't think if this doesn't fill your cup, you don't have to do this. Like I enjoyed doing this. I've been a content creator in one way or another since 2012. Like I have like always loved the internet. So it's only logical that I continue to do things on the internet, but I love to do it. I love to make the videos. I love to edit it. I love to like send it out. I love to comment. But if you are like, that sounds terrible, then there's plenty of us who like to do it. And you don't have to, right? Like there's other ways you can like, I know many OBGYNs tell me like, oh, you're on my dot phrase of like people to follow on social media, right? So you don't even have to do it yourself, but you can be open to your patients and be like, hey, here's a couple of resources. Cause I do this for like my menopause dot phrase and my PCOS dot phrase, right? Where I say like, here are some people to follow online. Right, you're guiding your patients to the people that you have vetted for them. And instead of letting them just like find someone random, you already know who that is. And especially if you spend any time just like consuming content, you already know the people that you trust, right? Like I know each of you can think of people like, oh, I'm in the emergency room, so I know that I'm going to trust so-and-so to talk. Like I'm going to trust Dr. Beach Jam to talk about emergency pediatric medicine. Like I trust her. I don't have to like go vet it more because I watch her content. So every single person listening, if you consume content, you already know a couple people. And so throwing it into a dot phrase for your patients to put on their after visit summary, you didn't go have to make a video, but you gave your patient a resource to like find that information online as well.
That's even sparked something like maybe you don't want to make content, but one thing that we all could do to help promote those creators that we do love is like or comment on their post or reshare their posts. Like they've already made the content that you trust and you like. That just helps the algorithm promote that instead of some other crazy creator that's, spreading stuff that you don't really
crazy things.
Yeah. So let's say there's a doctor out there who is like, okay, there are some things that I would like to get out there, but they're worried about professionalism, time, or backlash. Like, what's a baby step, or what's the lowest risk way for a physician to start contributing their voice online?
Yeah, I mean, I think you have to think about how you feel comfortable doing that. Do you want to make a video? Yes or no? You don't have to. I think just like thinking about it's as simple as like just picking an avenue first, right? If you just want to be like, I'm just going to be on Instagram, I'm just going to make some carousel reels about the risk benefits of this vaccination, right? You want to keep it evidence-based. You want to be able to cite your sources. You want to keep it professional. You don't want to, everyone here knows what it's to be professional, right? But you don't have to go crazy. It's not like I set out in 2021 that I was going to like I'm going to go have 1 million followers on social media. No, I just like one step at a time. And so like first step is pick a username. Second step, pick what social media you want to be on. Step 3, just put something out there, right? Like don't go look at my first 2 years of videos. They're not great compared to like, not that my videos now are like this amazing thing, but I was just doing it. I was just I wasn't thinking about it. You just got to like put one step forward and do it. I mean, to protect yourself, a couple of things. You want to look at your hospital social media policies, right? I personally choose to never have like my organization. Like I don't wear my sweatshirts in my videos. You can't see it in the background. Like I never say where I work. You can find out where I work. It's very easy to Google my name and know exactly where I work, but I don't put that on my social media, right? And so to create that divide, my hospital has given me some guidelines. They said, please don't film in our clinical spaces. That's fine. I can respect that, right? So there's some ways that you can still be smart about this if you're motivated to like get out there in one way or another.
And that's a good segue into this. There are internet trolls and any sort of, I was surprised when during COVID, would say what seemed like extremely neutral information, in my opinion. And people, just had opinions. So it is true when you start educating online that you may be exposed to some criticism and controversy. So are there any tips? You said check your hospital policies, maybe leave where you work out. Are there any other guidelines?
Doximity had put out a system, like a resource some years ago. I think it's called Doc Defender, where you can put in your information and it'll delete a lot of personal information that you have online off the internet. So that's a good place. If you're just thinking about like the physical safety, right, is to have your home address just deleted off the internet, basically. I think that's very helpful. People are always going to differ or have differing opinions from you. And like where I like that is like when people like they're not being mean, they're just like maybe disagreeing or they thought differently. And it's kind of like an opportunity to like converse with them. And like you can now engage in that conversation. If you're going to be mean to me, if you are calling me names or in any way threatening me, like block and move on. Like you don't deserve me and you don't get my time and you don't get my mental energy. And I like don't need to. Like this is the internet. So I don't have to like appease someone and just keep them unblocked because of whatever reason. No, if you're mean, like if you're being threatening, like bye. But for the most part, people aren't like that, right? They're there, but for the most part, people are like happy to have this information, are willing to listen. If they disagree, they might disagree, and that's fine. We all don't agree on everything anyway, but it's kind of an opportunity to catch them where they are and have that conversation.
I love that. So this does happen to be a physician wellness podcast, and a lot of physicians right now feel discouraged about the direction of medicine.
Yeah.
Is there anything from your perspective that gives you hope about the future of physicians and the physician-patient relationship?
I mean, I think part of it is the internet, to be honest with you, because I think people really are appreciating the work that people are doing online. And, there's studies that back that up, that people, one, get a lot of information online, but are more willing to trust the people who have the credentials to talk about it. And, in the end, people do want to learn about themselves, and that's what they go online for. And I think it also makes people see us as humans, right? Like, by sharing maybe little tidbits of yourself, or like if you talked about the struggle, like I've shared a lot about like, especially as I was like a brand new mom in residency, right? That like humanizes you. And people are like, I had to go back at 4 weeks postpartum. I can't, or like when I'm like, yeah, I went back at 6 weeks postpartum. Like, that's cruel. I'm like, it sure is, but that was the reality, And so it's hard. Medicine right now is in a really hard spot. The things coming down the pipeline financially for all of us and institutions, and how the government is helping to fund healthcare is demoralizing, and that cuts into every single second of our day. It cuts into how many patients we have to see every day to like make up for that, right? But I think there's like little glimmers of hope of people who again see that doctors are just like wanting them to be well, and that we want them to listen to us because we want them to be healthy, and I think part of the reason that I felt so strongly about like going online and sometimes talking about even just like the realities of like payment structure for doctors, right, is that when people be like, you only want to induce people because you're getting paid for the delivery. I'm like, actually, I'm like paid by shift. Like, I'm hoping to sleep all night. So actually, I don't want you to come in for your induction because I want to be sleeping. And then people are like, oh, I had no idea that that's how you got paid. I'm like, exactly. So these lies that you're telling about us are like not even true. And so there are, glimmers. And I think there's a lot of people who are creating their own paths in medicine, which I think is really exciting. You don't always have to work for the big system. And there's lots of ways that you can do patient care that isn't the cookie cutter form that like I work in. And I think that's exciting too.
Love it.
That is so great. Thank you, Dr. Fran, for spending this afternoon with us. We've so enjoyed hearing from you. We enjoy all of your content. We follow, like, share,
Thank
repost, all the
you.
things because we are arm linkers. So we believe that we can do a whole bunch when we all link arms and lift each other up and promote each other and give each other's stage. And I thank you and honor you for what you're doing to broaden that impact and to really just meet patients where they're at. So thank you so much.
Thank you. This was wonderful.
And that's it for today. Friends, if you found this conversation helpful, the best way to support us is to subscribe. So click that button now and leave us a rating and a review because it helps other physicians find us and it moves us up on the list. And we'd love to hear from you. So if you've had experience battling misinformation or going toe-to-toe with patients, email us, podcast@thewholephysician.com. We'd love to hear from you. And don't forget to follow us on the socials at The Whole Physician. We love connecting with you there. So until next time, you are whole, you are a gift to medicine, and the work you do matters.